My name's Toby Hanfield. I'm going to be one of two lecturers in this unit. My colleague Jackie, unfortunately, I forgot to bring along a teaching aid I wanted to use, and so she's dashed back to grab that for me. She'll walk in a couple of minutes, and I can introduce you to her then. But I'd like to make a start, since there's a fair bit to get through. So just very quickly, some administrative details. So I take it for many of you, this might be your very first unit at Monash. So the key thing to know is there's one document that is a very boring, unappealing document to read, but you really need to get acquainted with, and it's called the unit guide. And for every unit, it really has all the essential information you need in order to be able to pass the unit. It has details about how to contact your tutor, details about what to read each week, details about the assessment, details about how to get in touch with me or Jackie if you have questions for us, and so on and so forth. Where do you find the unit guide? Well, I think if you just Google Monash unit guides, you'll probably find them. But the other way you could go is go via the Moodle site for this unit. And all units in the Faculty of Arts have Moodle sites associated with them, and they'll almost always have the unit guide published on them. So get on there ASAP, check it out. You need to use the Moodle site even if you don't like these online learning environment things, because many of the assessments of this unit get submitted via Moodle. So get on there quickly, check you don't have a browser incompatibility, and take it from there. So this unit, we've got two units called Introduction to Philosophy. In first semester, it's this one called Life, Death and Morality, and that's an introduction to moral philosophy. In second semester, we have one called Time, Self and Mind, and it's an introduction to philosophy of mind and epistemology. What is moral philosophy, or what is ethics? And I'm going to use those terms pretty interchangeably. I want you to have an understanding of ethics that's very inclusive. It's basically just about justifying our behaviour, trying to offer reasons for what we do. Here's a quote from the Singer text that you've got for this unit. He says, "For people to be living to ethical standards is for them to believe for any reason that it is right to do as they are doing." So when you put it that way, you should realise this is a pretty inescapable activity for normal human beings. Right? We give reasons all the time. And if you imagine someone doing a rather strange behaviour, right? For instance, does anyone not know what this is depicting? Let me see where we're at with the culture at the moment. Okay, yeah, sadly you all do know what this person's doing. This person's eating a capsule that contains this toxic detergent, Tide Pods. Now, if you see someone engaging in a behaviour like this, you immediately start thinking, what reason could they possibly have for doing such a thing? Maybe they want to get famous on YouTube, or maybe they just want to look tough to their friends, right? If you ask them, why did you do that? And they said, no reason, really, right? They're a really disturbingly strange person. They should have a reason, right? And this becomes even more important if you think about actions we take that have impacts on others. What if this person was in fact, that's not the person who chose to eat the Tide Pod, rather we're forcing her to eat the Tide Pod, okay? And you ask me, why did you force her to eat the Tide Pod? If I said no reason, there seems to be something somewhat defective about me as a human being, you might think, right? So ethical justification is something we all seem to have some sort of interest in just as a normal part of everyday life. That said, the Singer goes on to note, maybe not any reason you offer would count as an appropriately ethical sort of reason. Right? If we come back to our scenario where we're forcing some poor person to eat a Tide Pod, and we did give a reason, we said, we found it really fun to watch her suffer. Right? That doesn't sound like an ethical kind of reason. Okay? So philosophers have thought about what distinguishes the reasons that just don't even seem in the running to be ethical reasons versus ones that are more appropriately ethical or moral reasons. And an idea that's appealed to a number of people, Singer likes this idea, but many philosophers throughout history have thought this is an idea that's on something important, is that the person who says, because it was fun, they seem only to be thinking about a justification from their own point of view. But an ethical justification should take a different perspective, what they call a universal point of view. Okay? A point of view that abstracts from just what's good for me and thinks somehow about what's good for everyone, or what's good from the point of view of the universe, or something like that. It's a bit hard to pin down exactly what it means, but it's definitely not merely a self-regarding point of view. That's the key move. Now, at this point, I've just introduced you to a slightly technical notion that philosophers have used, this idea of taking a universal point of view, as a way of trying to explain what makes ethical justification special and different from other sorts of justification. And this is where I hit one of the limitations of the lecture format. When you are trying to acquire a new concept, I'm sure you're not bamboozled by this concept, by the way, right? But you haven't read the many books by the many philosophers trying to work out what exactly this universal point of view is. So there's probably room for a bit of uncertainty, a bit of ambiguity. You haven't probably nailed down the concept yet. And the way you would ideally learn this concept is you would try it out. You would use it in discussion. You would try to mount arguments with it, or you'd ask me questions about it. But there's too many of you in a lecture for me to have that one-on-one interaction that ideally you would have. So this is why you've got that slightly odd envelope that I handed out a few minutes ago containing some flashcards. When I want you to try out a new concept, I'm going to give you a multiple choice question. And it's a way, yes, it's not ideal for philosophy to use multiple choice questions, obviously. We're not going to assess you using multiple choice questions by and large. But as a way of quickly getting a sense of, do these guys know how to use this concept, it's really, really helpful for me. I can work out, do I need to back up and go over it again, or can I move forwards? Okay? So here's a question applying this concept. Suppose somebody takes your wallet, but by the way, I should just add, if you're wondering how many of these slides do you need to take down as notes, I put up on the Moodle site every week a handout that has basically all the text of the slides, okay? It doesn't have the answers to these multiple choice questions, right? So you might want to make a note of the answers to these that I sort of reveal during the lecture, but other than that, pretty much everything else is there. Okay. Suppose somebody takes your wallet, runs away with it, afterwards they're caught and they're asked why they did it. Consider these possible replies. Reply 1, it was in my interest to do it. Too bad if it harmed someone else. Reply 2, although the person I robbed is worse off, I needed the money more than they did. Now, according to Singer, which of these might be considered attempted ethical justifications? Hold up your cards. Okay, and so what I'm seeing here is maybe 50% saying D, 30% saying A, and a few Bs as well. So there's a bit of diversity here. You haven't all understood the concept the way I was thinking about it. So this is often a good chance to take a moment to talk to someone else in the lecture theatre and see if you can come to a common understanding. So turn to the person next to you, see if you can come to an agreement on what you think the answer is, and I'll ask you again. Okay, let's, can I have another show of cards to see what you're thinking now? Hold up your cards, everyone. What are you thinking? Okay, so what I'm getting is, now I think the Bs have been eliminated. We're down to just As and Ds. Okay, that's good, that's progress. I think I was looking for D, but there's room for a bit of disagreement here, right? So the people who are saying, no, neither of them is even an attempted ethical justification, you might have been thinking about the fact that neither of them seems very good justifications, right? If they're so bad, how can they possibly be ethical justifications? And this is an unfortunate way in which there's a little bit of vagueness maybe in my question, right? I was saying, what's an attempted justification, right, even if it fails, right? Is this a really bad attempt to fly, right? Or should it just not even count as an attempt to fly, right? There's room for disagreement there, I take it. But the thought is, you all were tracking the fact that this one doesn't look like it's even an attempt because it's clearly just taking a self-regarding point of view. This one, look, it does at least refer to the relative needs of the two different people. How much do I need it? How much do they need it? Maybe it's not successful as an ethical justification, but at least seems to be moving beyond the purely selfish. That's the thought. Okay? Good. So, with that in mind, with the idea that ethics is all about justifying behaviour from this distinctive point of view, here's a question you might say. Toby, you haven't mentioned philosophy yet. What's philosophy got to do with justifying behaviour from a universal point of view? I've emphasised how everyone tries to do this. Right? They try to explain why their behaviour is acceptable, at least from their own point of view, and sometimes from a universal point of view. Why do we need philosophers to come in and contribute to this discussion? Well, I should note, many people don't like philosophers contributing to this question, right? Particularly religious authorities sometimes find philosophical theses about ethics challenging and controversial. If you read the preface to Singer's book, he'll tell you about violence and death threats that he has suffered as a result of advocating his ethical views. Right? That said, I do think philosophers have something to offer. And the reason we have something to offer is because philosophers are particularly expert at assessing how good arguments are. Now, of course, you're going to be studying other things in the university where you'll be looking at arguments, right? You might be doing history, you might be doing chemistry, you might be doing mathematics. Arguments will come up in all of these fields. But there's a reason why philosophers, maybe there's a touch of arrogance about this, right? But we kind of think we're the best at assessing arguments. There's a slightly embarrassing reason for that, which is we've got nothing else to do, right? We can't wheel out a microscope to answer the question, do humans have free will? Or is the mind identical to the brain? Or, I don't know, is the world made of one substance or two, right? You can't just look in historical documents the way a historian would to solve that. You can't look down a microscope the way a microbiologist would. You can't sort of mix two chemicals together in a lab the way a chemist would, okay? All you can really do is start with what you know and try to construct arguments and see if that will help you to find out the answer, okay? And so that's why we think we're particularly good at assessing arguments, and arguments are a means of showing other people what our reasons are. So my claim is, by doing philosophical training or using philosophical techniques, you're going to be in a better position to assess the quality of other people's ethical justifications and your own ethical justifications. And that might lead you to change your ethical views, which might be an interesting thing to undergo. It might be a confronting thing to undergo, but might be a valuable experience too. Now that's a bit abstract. Let me get a bit more concrete. How's this going to actually work this semester in these lectures? How are we going to be thinking about ethical justifications? I'm basically going to give you a number of thought experiments that involve difficult choices. And I'd like to start from your own opinions about what you think might be the right thing to do in these cases. And then I'm going to invite you to try and justify your choices. And we're going to then rigorously, critically assess those justifications and see, do they really stand up? And we're going to see at the end, can you make coherent sense of your own ethical views, or is there a reason to move to some of the other sorts of possible positions we will have come across along the way? Now, of course, thought experiments, this is a broad category. We could have thought experiments about promises, about stealing, about creating new human beings with stem cells, nuclear weapons. You know, ethical questions come up in all sorts of domains of life. How are we going to narrow it down a bit? Well, the unit is called life, death, and morality. So we're going to focus on questions about killing. We're going to start out thinking about killing in various emergency rescue situations and whether it would ever be justified to kill there. Then we'll move to self-defense. Then we'll move away from just thinking about human beings and think about other species. And is there something especially bad about killing humans, or are the reasons why you might think killing humans is bad going to generalize and mean that it's bad to kill other animals as well? And then we'll move right to sort of the boundaries of becoming a human. What about killing a human fetus? How can we generalize our earlier theories to those difficult borderline cases there? Right at the end of the semester, after we've thoroughly exhausted you with thinking about life and death and killing, we'll move actually back to some big picture questions about the nature of morality itself. We'll look at things like cultural relativism and difference of traditions of thinking about what ethics is and where you might get moral facts from. Okay? But for now, let's get into it. I'm going to give you a couple of these thought experiments and give you a sense of what's going to be happening throughout the semester. So the first is the trolley problem that probably many of you have heard of by now. But don't worry, this is going to be the deluxe, the best treatment of trolley problems that you've ever seen. Okay? The unit reader refers to it as the runaway train, but two of my favourite philosophers, Philippa Foot and Judith Thomson, came up with the trolley case, and they call it trolley, so I'm going to stick with that. It's a nice simple word rather than runaway train. Okay, trolley, if you're not familiar, is just an old-fashioned word for a tram. Okay. So imagine this scenario. You're out for a walk one day beside the tram tracks, the trolley tracks, and you see, rushing along at great speed, this trolley. The driver signals to you, it's out of control, I can't stop it. Okay? And you can see that the way the tracks are currently configured, it's going to go down this left-hand track where there are 5 people. And for some reason that's beyond my ability to draw, the 5 people cannot run away or step aside. They're going to be killed, okay, unless something happens, something intervenes. There is something you could do. You could operate a switch which is going to divert the trolley down the right-hand track. If that happens, however, there is one person on the right-hand track who will certainly be killed as a result. Okay? Any questions about the setup? Pretty straightforward. Okay. So here are your two choices. If you turn the trolley, you will kill one person but save the 5. And if you don't turn the trolley, the 5 people on the left-hand track will die. Now, sometimes I use the cards, as I said, to get you to try out a new concept and check your understanding, but sometimes they're handy just to poll your opinions. So now, I'd like to know, what's your personal opinion? Is it morally permissible to turn the trolley? A for yes, B for no. Okay, so maybe about 80% yes, 20% no, right? So here's your chance. I'm interested in both ways people might answer here. How might you justify your answer? Yeah. Right. Can you say a little more about why it's good or desirable, or?
Well, you're saving 5 lives for the cost of 1, so you're at a net positive.
Sure. Good. And your name?
Jake.
Jake. So Jake's saying, get more lives this way, right? Seems like a good consideration. Yeah, up the back.
I say you shouldn't do it if you do turn the trolley.
Yeah.
You're actively killing someone. If you don't turn it, then it's a situation that you couldn't control in the first place.
A situation you couldn't control in the first place.
But if you turn the switch, you're actively choosing to kill that person.
Good. Your name?
Matt?
MAC? K. Okay. So Mac's saying there seems to be some difference between killing, which happens when you pull the lever, versus some other way death eventuates if you don't pull the lever. So let's say letting die, right? Yeah.
I'd say that letting someone die and actively doing it yourself, the only separation between the two is kind of a selfish need for not wanting to have the guilt of being active in the death. But if you think about those 5 people, and you think about all of the people they know, let's say they each have 4 family members, that's affecting 20 people. The ripple effect, the impact of those lives is so much larger.
Yeah.
I think it's harder to pull the switch and take that responsibility on yourself, but the impact is beneficial.
Good. Your name?
Jack.
Jack. Okay. Yep.
In that sense, you're also actively choosing not to save 5 lives.
Right. Good. So yeah. So and your name? Bella. So Jack and Bella are sort of responding to Mac's suggestion. There's a difference between killing and letting die, saying, look, isn't choosing to let people die just as morally significant? And Jack saying he recognises it's kind of harder to do it by your active involvement, but still, the very large benefit somehow outweighs that. Yeah.
I would just agree in the sense that, people say that bystanders are just as bad as the people that bully. I think, to not, you're just avoiding the guilt. You're doing it for yourself if you don't pull the lever.
Right. Good. And your name?
Lulu.
Lulu. Okay. Good. So we're going to spend a while thinking about these. There's more opportunity for discussion, but let's move to looking at some principles. So remember what I said, ethical justification is justifying your behaviour from this universal point of view. So when you offer a justification, it'd be nice if you can kind of sum up in a very general principle the basis on which you're acting. And we heard something like that with the idea of, well, save the greater number of lives seemed to be the principle underlying, now I've forgotten, Jake? Yeah, underlying Jake's answer, right? And underlying Mac's answer might be something like, don't kill people, right? That's the basic principle there, even if that means letting lots of people die, right? So those are some very rough expressions of the kind of principles you might have. I want to now introduce you to 2 particular principles that we're going to use as a focal point for discussion. I'm not assuming the truth must lie with these 2 principles. These are just attempts to put it into a very easily accessible general form, okay? So, and remember, the reason why a principle is an attractive thing is it looks like the right kind of candidate if you're going to offer a justification from a universal point of view. So here's the first principle. We'll call it the sanctity of life principle. It says, it is always wrong knowingly to kill an innocent human being. I think this is a pretty plausible sounding principle, right? If you polled people on the street is this true? Is it ever okay to kill an innocent human being? We'll say, no, it's never okay, would be the proper response, right? That's I think, a common sense attitude to have. We'll think more later about how commonsensical it is. Let's just check the implications of this principle then in the trolley case. What does SOL advise regarding pulling the lever in trolley? Does it say A, it is permissible to pull the lever, or B, it is not permissible to pull the lever? Okay, good. Pretty much everyone is saying it says it's not permissible, and that seems pretty straightforward, right? Because pulling the lever, we agreed, was killing somebody, and it seems to be saying you never can do that. As far as we know, the person on the right-hand track is innocent. Okay, maybe you can imagine some variation where they're a dastardly villain who trapped the 5 on the left-hand track, right? And then maybe it's a different, this principle just won't apply, okay? But as far as we know, they seem to be innocent. Good. Second principle, the best consequences principle. This one says one ought to act so as to bring about the best achievable outcome. This also, I think, sounds pretty appealing. It's a bit less concrete than the other one that focuses on killing. This is talking very generally about achieving good outcomes, okay? But surely that seems like a pretty sensible idea. But now let's apply that principle to the trolley case. By the way, I'm going to abbreviate these SOL and BC since I'm going to use them quite a lot, okay? So what does the BC principle recommend we do? A, it's permissible to pull the lever, or B, it's not permissible to pull the lever. Good, you're getting this pretty straightforward. It seems to be saying, yes, you should pull the lever. You'll bring about a better outcome that way. Okay, we've got 2 principles in our back pocket now. Let's now move on to a second case and see how those principles go, reconciling our earlier views. So this case is known as transplant, or sometimes spare parts surgeon. So suppose you are an extremely talented organ transplant surgeon. When you perform an organ transplant, people have a perfectly normal life expectancy afterwards. Okay? They live long, healthy, happy lives, just as good quality as people who never had an organ failure in the first place. And normally you feel pretty good about yourself for the amazing good you do in the world, but the problem is you've run out of organs to transplant, and you have 5 patients who desperately need transplants, or they're going to die imminently. All 5 patients have a very rare blood type, the same very rare blood type, and thus that's why it's been so hard to find organs for them. So since there's nothing you can do for them right now, you're making some money on the side by doing a nose job for somebody, and it occurs to you as you're performing this operation, you know what, this person has that very rare blood type, and they've signed their organ donor card. And I could, at this very moment of the operation, just with a little twist of the scalpel, fake an error. Okay? Everyone else in the operating theatre would think a terrible accident has occurred, but I in fact would have deliberately killed this patient I'm operating on right now. And because they've signed a donor card, and because they're the right blood type, I will get all 5 organs that I need to save the 5 patients. Okay? So, 2 options. 1, fake the mistake, killing the 1, save the 5, or perform the operation as normal, the 1 will live but the 5 will die. Again, your opinion. May the surgeon kill 1, save the 5. A for yes, B for no. Okay, so now the numbers pretty much inverted from what we had before when I asked you the trolley case. Now, about 80%, maybe 90% saying no, surgeon may not. 10%, I hope are not studying medicine, saying yes. Okay. And now let's check what our principles say. Does the sanctity of life principle say the surgeon can kill 1 to save the 5? A for yes, B for no. Pretty straightforward. Right, obviously the sanctity of life says you never can kill an innocent person. This is an innocent person, you better not kill. What does best consequences say? A for yes, B for no. Right, most of you thinking that the way I've set it up, it looks like a better consequence in some sense will follow if the surgeon in fact kills 1 person. Okay. So, the majority of us face some sort of conundrum. Some of you might have said it was wrong to kill in both cases, and you can just sign up to the sanctity of life principle at this stage, and you'd be kind of comfortable. Others might say it's okay to kill in both trolley and transplant, and you could sign up to the best consequences principle. But many of you shifted opinions, right? You said it's okay to kill in the trolley case, not okay to kill in the transplant case. And neither of our principles that we've looked at so far fits that change of opinion. So what sort of reasons might you offer to explain the difference between these cases? Any suggestions? Yeah.
I think it seems with the trolley problem that by just letting the trolley go, you're being inactive, but the surgeon, by not, killing that one person, he's inactively killing 5 people. So I think that's why people get confused because they're not seeing that in both situations you can be inactive.
Oh, so are you a kill in both person? No, you're a don't kill in both?
Yeah.
Don't kill in both cases. No killing in both cases. Okay, good. And so that's because you think people have a mistaken view about pulling the lever in the trolley case? That
They've got a mistaken view that only the trolley is inactively killing 5 people.
okay. Inactively. Is
by
that
not
fair?
pulling the lever.
I see, passively. Gotcha. Good. Yeah.
So I think that, like, with the certain scenario, it's more the fact that the patient trusted you with their life, and it's kind of that whole, like, thing where they went into the operation thinking they'd have a nose job, whereas the train you can't stop, it's moving, inevitably you're going to kill someone. Whereas, obviously the person that went into the nose job they trusted you to just do the nose job, and it's your role as a doctor to not kind of abuse that.
Good. So your name, sorry?
William.
William suggesting maybe something about a relationship of trust. Was another person over here with their hands up? Yeah.
I was going to basically say the same thing.
Okay.
Like a surgeon is, in charge of their patient's life at that time.
Yeah.
So it's kind of similar, but it's more like they were put into this position for you to perform the surgery and keep them alive throughout it. Whereas if you just kind of came across the situation with the trolley, so it's almost more of a choice with the trolley problem than the surgery problem.
Okay, good. So the idea that trust, I suspect trust, the special relationship between a patient and doctor, does make some difference, but we can kind of test that hypothesis if it's enough to explain all the difference by trying to imagine a version of the transplant case that lacks that relationship of trust. So imagine you're not performing a nose job, you're still this brilliant organ transplant surgeon, but you've decided to take a walk by the beach. And there's this guy who's fallen asleep on the beach. And his wallet's fallen open. And you see his organ donor card. And you see, oh, he has that rare blood type. I could just pull my van up, stick him in the back. No relationship of trust, so it's okay, right? I would be saving 5 lives, killing 1, but no breach of trust would occur because he didn't come to me as my patient, right? It seems to me improbable that you're all going to say, oh yeah, that's fine. That's just like the trolley case, right? It still seems like a horrifically wrong thing to do, I think, to common sense. Yeah.
I feel like the difference is that in the medical case, the 4 people that need the organ transplant, they at least have knowledge of what they're facing. And they, when you come with a fatal or some kind of condition, you have to, whether you accept it or not, death is a high chance, and the nose job person is simply just going in for a nose job with not any part of their radar thinking of death involved, whereas these people at least, whether they choose to or not, have the opportunity to accept their deaths.
Good. Yep.
The reason why I swapped between points was in the trolley situation, either way somebody is going to die. So to say 5, you killed 1 person, but in the nose job scenario, 1 person is not inevitably going to die, and you're making a choice to kill them. Although,
Yeah, good. So your name, sorry?
Jack.
So it's a common response to somehow feel like in the trolley case somebody has to die anyway, whereas that doesn't seem the case in the transplant case. But remember how I described it. If you don't kill the 1 in transplant, 5 people will die. And the other option is you kill the 1 and the 5 people who live. 2 choices, somebody dies in both choices, right? There is some sense psychologically in which, yeah, but dying by organ failure just isn't quite the same thing as dying by a runaway trolley, but we need to put our finger on what that is. That's the puzzle, okay? Now, I'm going to move on. There's going to be more time in your shoots to discuss this, right? But roughly what we've got to try and do in the rest of this lecture today, how long do I have? Yeah, a bit of time. I want to now spend the rest of today's lecture drilling in and focusing on the sanctity of life approach, okay? So that would be the approach that might appeal if you thought it was wrong to proceed in both cases, and sort of subject that principle to a more rigorous scrutiny. Next week, we're going to focus on approaches that are built around best consequences, okay? And then beyond that, we're going to try and come up with compromise views that might have a bit of the best of both worlds, okay? This is where we're up to so far, though, right? So I've told you what ethical justification is, and we've started this search for some sort of appropriately universal principle that will explain your judgments, and that's all of you. I've just focused on the puzzling judgment that says okay in one case, not okay in the other, but we really want a principle that's acceptable to everyone here, okay? Our judgments about cases like that. And the majority of views thus far seem to be in trouble, okay? Let's now focus on the sanctity of life principle. Here's sort of like a moral I want you to take from the transplant case. Okay? You can imagine cases, maybe they're a bit far-fetched, but you can imagine cases where killing brings about a better outcome. All things considered, the world is just a better place having had that killing take place. But still, we have this feeling that, no, that would be wrong. Many of us do, anyway. Okay? Transplant is basically designed to be like that, okay? I invite you to spend some time thinking of other cases, right? Think about cases where, in order to get 5 to the hospital in time, you have to run over a homeless person in the street. Yes, in some sense it's better, but no, you shouldn't do it, right? Is a very common reaction, okay? In fact, trolley cases are weird rarities, right? A rarity of a case whereby we seem to think it's okay to kill to bring about a better consequence. In general, the default view, I think, is no, even if it brings about a better outcome, killing would be wrong. Right? Now, there's a difficult question lurking here. Why is killing so especially bad that you can't do it to bring about better consequences? Okay, and that's something we'll sort of circle around and hopefully make some progress on in future weeks. But for now, let's just accept this idea that there might be some special badness with killing independent of its consequences. So even if the killing leads to a good outcome, like saving many, many lives, there's still something bad in the action of killing in itself. Right? And in that case, a rule that says something like, don't kill, and a rule that's really simple, it doesn't say, don't kill in such and such circumstance, or don't kill if the consequences are bad, okay? It just says don't kill. That might be a really sensible rule to adopt. And that's exactly what the sanctity of life principle is. It doesn't mention consequences. It just says certain sorts of killings, those of innocent people, don't do them. Full stop. Okay, so I want you to keep that in mind as like, it seems to be the motivating idea behind this sanctity of life principle. Here are 3 things I think you can do as part of a philosophical health check on any moral principle you come across. First, you can check the implications of that principle in hypothetical cases. Now, we've already started doing that. We've looked at transplant and trolley, but there are many, many, many more cases we could think about. So we should spend a bit of time doing that. Second, there are certain theoretical features you might want a principle to have. You might want it to be universal in some sense. You might want it to be very general. You might want it to be simple. So we should try and make some comparative assessment of the principle on that basis. And finally, we've got to check if there are any presuppositions underlying it, okay? And a crucial presupposition is the one that sort of came up when Mac before spoke about killing versus letting die, right? It seems to be a presupposition of this approach that killing is very different from letting people die. And is that a presupposition we're happy to live with? Okay? So let's quickly try and get through all 3 of these. First, does it have problematic implications in other cases? So now imagine, just like the original trolley case, but the trolley tracks are really crowded. There's 500 people on the left-hand track. And this trolley is very, very powerful. It's actually going to plough through and kill all 500 people unless you pull the lever. Okay. Well, what does sanctity of life say now? Does it say, A, it's permissible to pull the lever, or B, it's not permissible to pull the lever? Okay, right. 99% of you are on board with me. It seems to me it's saying it's impermissible. That would still be knowingly killing people, a person, if you pull the lever. Okay. And so if to now you've been thinking, yeah, sanctity of life seems right, when you realise what's going on here, you might start to have some doubts, right? What if it's 5 million people on the trolley track, right? What if it's the entire population of Australia, unless you kill this one person, right? Surely there must be some breaking point, might be your thought, whereby it is now okay, terrible though it is, to kill somebody in order to avoid a truly catastrophic outcome. How you draw the line between catastrophic and non-catastrophic, I don't know, but that might be one thought you have. You might think there's something problematic about this. Short takeaway lesson from this, it's a very, very strict principle. And I would suggest in your tutes, have a think about some other cases, like lifeboat cases, where unless we kill one of us, all of us will die. What's it going to say about that? Or think about killing someone with their consent. What if it's a case of euthanasia, where someone says, please kill me, my life is a misery? Would that be okay? Think about cases of killing yourself if you want to commit suicide. Would that be permissible? I suggest many of these cases look prima facie like they're going to be ruled as impermissible, and you might think also those are problematic implications, or not. Okay? But that's important sort of part of calibrating your mind to understand really what does this principle entail. Okay? So that's the first thing to do to check the implications. As I say, talk about that a bit more in your tutes. Second thing though, what do you think about the comparative generality of the two principles we've seen so far? Sanctity of life and best consequences. There's a number of things you might have in mind here, so I'm just interested in your hypotheses. Can you see some sort of difference between them in terms of their scope or their generality? Lulu? Oh, so you weren't Lulu, you're Bella. Yes.
It's more a question of what you should and ought to do, whereas sanctity of life is far more universal.
More universal. Okay. Yeah. I'm not quite getting that. I mean, they're both... It's true that this one talks about what you ought positively to do, whereas this one is talking about things that you definitely ought not to do, right? So that's one important difference. Any other suggestions? Yeah?
Best consequences covers life and everything else that has consequences involved, so it has more scope and generality.
Great. And your name?
Harley?
Harley. So Harley's saying best consequences seems to apply to lots and lots of choices, whereas sanctity of life only really applies to decisions whether to kill or not, right? So think about all the decisions you made this morning. Shall I drive to university? Shall I get public transport? Shall I ride my bike? Shall I buy a coffee? Shall I just wait till after the lecture to get coffee? Shall I have that muffin that looks tempting? Hopefully, nowhere on your list of options was, shall I kill my roommate? Right? In which case, sanctity of life had no advice to give you all day, right? It's just silent, because none of your options are relevant to it, okay? Whereas best consequences, you could theoretically go, well, would it bring about a better outcome if I ride my bike, or if I get public transport, if I drive my car, right? It might be hard to tell, but at least theoretically it seems to give some guidance. Yeah?
Well, I guess best consequences is a very subjective term, though. Like, for the one person that you're killing in the trolley, it's certainly not the best outcome. Or if you're saying riding your bike to work, that might be good for the environment, but maybe it's not good for your knees, so it's not good for yourself.
Really good. So this is one potential problem with the best consequences principle, is it's got this word best in it, and so maybe that's a bit more open for interpretation than any of the words in the sanctity of life principle, right? And indeed, one big thing we're going to do next week is we're going to look at theories that say, we're going to grab the best consequences principle and then give you a very specific, precise theory of what makes outcomes good, better, best, and we're going to do it from a universal point of view. So your knees, they just don't count for that much. We're going to take the universal point of view, that they count for something, but just a little something, right? And maybe the environment's going to outweigh them, is the thought. Yeah.
The best consequence one also places an emphasis on acting. Acting to bring about the best consequences, sorry, that's repeating.
Yep.
Whereas the sanctity of life allows for a lot of room of being the bystander, passive action or inaction, really. So allowing people to die through inaction, whereas best consequences requires you to act.
Yeah, good. So this is one thing that some people worry about the best consequences principle. It looks kind of demanding. All the time, I've got to do the best thing, right? Whereas principles like sanctity of life just say there are certain really terrible things, avoid them. And then you've got a bit of freedom in your life to choose. Coffee, muffin, up to you, right? But the best consequences seems to be saying, I've got to work out what actually would be best for the world, whether I have a coffee or a muffin or both, or neither. Oh my God, how will I deal with that, right? Now, people who defend this principle have a bit more to say to respond to that worry, but that is certainly a difference. Okay, so quick question then, just to clarify some of the issues we've raised in this discussion. Which principle gives guidance in a wider range of circumstances? Yeah, pretty straightforward, right? I'm claiming it is indeed the best consequences principle, because it seems to apply to everything you do. The guidance could be hard to work out because that subjectivity of what makes something better or not, right? But at least it does seem to be offering guidance. So I don't think that's a fatal problem for sanctity of life, but it does mean it probably couldn't be a moral theory on its own. You're almost certainly going to need to add other principles. Principles about breaking promises, principles about punching people, principles about cheating on tests. Right? All these seem to be morally relevant things, and you wouldn't really have a full theory unless you added that stuff in as well. Okay. Finally, and I'm not going to get right through this, but what sorts of presuppositions might be involved in defending this principle or using it? I think really the most interesting, deep kind of presupposition is the idea that there is one option in a case like trolley or transplant, which is letting 5 die, and that's different from the other option that is a killing. Different in an important sense. Are you Lulu? Yes.
Sorry, I just didn't catch what is a presupposition?
Oh, just something that it's not there in the text of the principle itself. No one, when I wrote down the sanctity of life principle, I didn't say, by the way, there's a difference between killing and letting die, but it seems like very hard for anyone to actually use it unless you make this supposition, right? So it wouldn't make much sense if you didn't think there was a difference of that sort, yeah. And we've had some pushback already on that presupposition, right? People have been saying, and I think it was Jack, saying, no, there's not such a big difference. And Bella saying there's not such a big difference between killing versus letting die. Letting people die is kind of like killing them, okay? One thing I suggest we do, this is a hard question which you need to keep thinking about, try to avoid semantic debates about the meaning of the word kill, okay? If you don't like this presupposition, don't say, oh, I'm going to use the word kill such that it means the same thing as letting somebody die. So if the surgeon doesn't chop up the one patient, they are killing the 5. And if you don't pull the lever, you are killing the 5. You could do that, but it kind of makes it a boring debate, because it's kind of like, let's go to the dictionaries and solve who wins this argument. And that's not what I got into philosophy to do. Instead, you should give to the person who wants to use a principle like sanctity of life. Let them use the word kill however they like, but ask them to explain the difference, right? So that's my proposal. We'll grant there does seem to be some difference between doing harm versus allowing it, right? It's roughly your idea, actively being involved in death versus passively being involved in death, right? There does seem to be some real difference there. The question is that a morally relevant distinction? Okay. Now, each week, as well as the lecture, we've got a little video to sort of fill in some of the extra stuff. Most weeks you're supposed to look at the video beforehand, it's like warm-up, but this week obviously you didn't know about it, so we've made it a post-lecture video, and I rant on for another few minutes about this issue of killing versus letting die in that video. Otherwise, that'll do for today. On your way out, could you please drop off your envelope in the blue bucket by the front, and I'll see you next week.